Asthma and chronic obstructive pulmonary disease, or COPD, are two common respiratory conditions that affect millions of people worldwide. They can cause a range of symptoms, from mild wheezing to severe shortness of breath. While both conditions affect the lungs, they are distinct diseases with different causes, risk factors, and management strategies. Asthma is a chronic inflammatory disease of the airways that causes recurrent episodes of wheezing, breathlessness, chest tightness, and coughing. These episodes are usually associated with widespread but variable airflow obstruction within the lungs. This obstruction is often reversible, either spontaneously or with treatment. COPD, on the other hand, is a progressive lung disease characterized by persistent airflow limitation. This limitation is not fully reversible and is usually associated with an abnormal inflammatory response of the lungs to noxious particles or gases. COPD encompasses several conditions, including emphysema and chronic bronchitis. Understanding the differences between asthma and COPD is crucial for effective diagnosis, treatment, and management. This essay aims to provide a comprehensive overview of asthma and COPD, exploring their causes, risk factors, complications, management strategies, and prevention tips. We will also delve into the specific considerations for children and discuss dietary recommendations for both conditions. Asthma and COPD both involve inflammation and narrowing of the airways, but the underlying mechanisms differ significantly. Understanding these differences is key to effective treatment and management. In asthma, the airways are hypersensitive to specific triggers, such as allergens, irritants, or exercise. When exposed to these triggers, the immune system overreacts, causing inflammation and swelling of the airways. This inflammation leads to bronchospasm, where the muscles surrounding the airways tighten, further narrowing the airways and making it difficult to breathe. COPD, in contrast, is primarily caused by long-term exposure to irritants that damage the lungs and airways. The most common irritant is cigarette smoke, but other factors like air pollution and occupational dusts can also contribute. This damage leads to chronic inflammation, mucus hypersecretion, and structural changes in the airways and air sacs of the lungs. One key difference is the reversibility of airflow obstruction. In asthma, the airway narrowing is often reversible, either spontaneously or with medication. In COPD, however, the airflow limitation is largely irreversible and progressive, meaning it worsens over time. Another difference lies in the inflammatory response. Asthma is characterized by an eosinophilic inflammatory response, meaning there is an increase in eosinophils, a type of white blood cell, in the airways. COPD, on the other hand, typically involves a neutrophilic inflammatory response, with an increase in neutrophils in the airways and lungs. Understanding these distinct mechanisms is crucial for developing targeted therapies for asthma and COPD.
When it comes to asthma and COPD, understanding the causes and risk factors is essential for managing these conditions effectively. For asthma, common triggers include allergens like pollen, dust mites, and pet dander, as well as irritants such as smoke, strong odors, and air pollution. Physical activity and respiratory infections can also trigger asthma symptoms. It's important to identify and avoid these triggers whenever possible to keep asthma under control. For COPD, the primary cause is long-term exposure to harmful substances like cigarette smoke, which is the leading risk factor. Other contributors include exposure to air pollution, chemical fumes, and dust, particularly in occupational settings. Genetics can also play a role, as some people are more susceptible to developing COPD due to inherited factors. By understanding and mitigating these triggers, individuals can better manage their symptoms and improve their quality of life.